Is now starting. All attendees are in listen-only mode.
Hi, good afternoon, everyone. Today is Wednesday, June 10th. I'm Donna Will, Professional Development Coordinator for the Developmental Disabilities Administration. We welcome you to the Maryland Community of Practice for Supporting Families webinar series. This is webinar number 4, Connecting with Family Members During COVID-19, and this is Q&A with DDA. The session is being facilitated by Mary Ann Kane-Bresci, Director of Family Supports for DDA. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There is one option for listening to the webinar, and that's by computer. There are multiple handouts for this webinar. 2 of them are loaded into the platform, and then the others I'm going to be sending out an email in about 15 minutes. So look for that in your email. We are recording the webinar today, and any questions you have can be typed in the question box or chat box, however it is in your platform, in your panel. And we will be reviewing those, and we also want input from you on future webinars and strategies you are using for making connections with your families. If you would like to reach us by email, please send an email to mary.kane-bresci@maryland.gov or me, donald.will@maryland.gov. So now I'd like to introduce Mary Ann Kane-Bresci. Good afternoon.
Good afternoon. Welcome, everyone. On behalf of the Maryland Community Practice for Supporting Families, welcome. I want to welcome you and our panelists to our webinar on Q&A with DDA. I'm going to introduce you momentarily to our panelists. I have to tell you, I think you're in for a treat. We've got amazing, they all happen to be women, but amazing women with a tremendous amount of information and expertise and experience to answer the question you've already submitted. And if we have time to answer your questions, you can submit at the end of the presentation. Many of you know already, my name is Mary Ann Kane-Bresci. My husband and I are the parents of 4 children, all of which are grown. Our youngest, Maggie, and our only daughter, has multiple disabilities. She's the reason for me coming into the field, and as a result, I've been in the field for over 20 years now, and working in various capacities around supporting families. But I'm here now, fortunately, with the Developmental Disability Administration as the Director of Family Supports. Throughout this series, we'll be addressing challenges that people with disabilities and families are facing, not only during COVID, but just in everyday life as they experience it, and always with the thought of what life might look like beyond COVID. And as we opened, we are, if you've already, this is our 4th webinar, you know that we invite guests and subject matter experts to discuss these challenges and address these issues, but we always do it through the lens of charting the LifeCourse framework. For those of you who are unfamiliar with charting the LifeCourse, it is a set of universal principles and tools. The fundamental principle of charting the LifeCourse framework is that all people have the right to live, love, work, play, and learn and pursue their aspirations in the community, even during the time of COVID, to whatever extent they can. So we really want to support people to do that. And we do that through integrated supports and services. Charting a LifeCourse was developed by the University of Missouri, Kansas City, out of their Institute for Human Development and Family to Family program. It was developed by parents and people with disabilities for other families and people with disabilities to create a vision for a good life, think about what they need to know and do in order to achieve it, navigate and develop supports and other resources, and discover what it really takes to live the lives of their choosing. And again, just do it. These principles are universal, as I mentioned earlier, but they in addition to working, when we work with people with disabilities and families, these principles inform the work of the Maryland Community of Practice, of which we're part of the National Community of Practice, as well as the work of the Developmental Disability Administration, all in an effort to create regulation, policies, and practices to better support people developmental disabilities and their families, as their families support them to live their best lives. Throughout the webinars, I always pick one or two principles or tools and to talk about throughout the webinar. And in this case, we're going to use the integrated support star. As a principle, the integrated star recognizes that all people, all of us, need support to live the lives of our choosing or our good life, and not just people with developmental disabilities. And not only do we need supports and resources, we need lots of them. And the more, the better, or the more, the merrier, right? The more we have access to, the more we can be supported throughout our lives, the likelihood that we're going to achieve whatever it is that we want for our lives. Or another way of saying is it's going to put us in a positive trajectory towards reaching our goals. The integrated star as a principle and tool can be used by anyone, families or professionals, to guide their thinking about the supports. It can be used for mapping current services and supports, problem solving for a specific need, or planning next steps. The star can help explore current needs, identify gaps, or plan how to access supports in the future. So for today, what I'm doing here with the integrated support star is we're identifying DDA as a support or a resource that is available to people with disabilities and their families. And it's identified as an eligibility-specific support. And the reason for that is because you have to meet the criteria to be eligible for those supports. But what I want to highlight is that it is a support. It is not the only support available to others. And as we go through these questions, we're going to be able to offer not only what DDA may be, how DDA may be able to support you or your family member, but what other resources are available to you as well. So let's get started. And to get started, I want to introduce our panelists. Now, the goal here is for everyone, our panelists, to be able to open their webcam, but we learned that we are restricted with the number of webcams that can be opened. So you're not going to be able to see everyone, but I'm going to tell you who they are. We've got Patricia Sestoki, who is the Director of Programs here at DDA. We have Rhonda Workman, who is the Director of Federal Programs, Janet Furman, Director of Children's Programs, Stacy Jones, Acting Director of Quality Enhancement, Jessica Stein, who is our Western Maryland Regional Advocacy Specialist, and Cindy Kaufman with SEEK, and who is the Director of Strategic Operations. Both Patricia and Rhonda have agreed to remain in the wings, watching over us, while the others, I'm going to invite you now to open your webcams. And you may be opened, and I just may not be able to see you. There they are. Okay. Hello, everybody. I've asked them, yeah, go ahead, everybody say hi. You can unmute yourself to say hi.
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 Hello,
Jessica?
it's Patricia.
Stace?
I said hi. Hi.
Oh, I'm sorry. Jessica? Okay. You're muted, Jessica. Okay. Okay. All righty. Well, let's get started and with our questions. Okay, let me bring everybody over so I can see them. So the first question pertains to people with disabilities and returning to work. And so, Jessica, I'm going to ask you this question, and I wasn't able to hear you. There you are. Perfect. Okay. So let me ask the question. If a person with intellectual and developmental disabilities works in a grocery store as a bagger, should they go back to work now? And is there any guidance for doing so?
Well, my response to that is if the employer says that the person can come back to work and the individual's ready to go back to work, then they should go back to work. They should also ask their employer if there is some standards that they need to do, like wear a mask during their whole shift, if they have to wear gloves, all those types of things. You should also make sure the person can wear a mask, because some individuals can't tolerate a mask on their face for various reasons. So if you have a person who can tolerate a mask, a couple minutes each day, you should work with them, say 5 minutes a day, and just keep extending the time out so they can get used to wearing that mask for long periods of time. That's the only thing that I can really suggest for that question.
Okay, well, thank you very much. Now I'd like to ask Cindy, who represents a provider organization, SEEK. What are some of your thoughts as a provider of that kind of service?
I think I would probably echo everything that Jessica just said, and maybe add a piece or two. Again, I think it goes back to if the employer is asking people to come back, you need to know under what conditions, what precautions does each person have to take. It's very important to know the tolerance level. If I can take my mask, but if I can't wear it for longer than 2 minutes, I don't know if there's enough support to get me through a work day. I think the piece that I would add in addition is because it's such a highly individualized answer, I believe, it depends on the role, it depends on the person, their ability to tolerate everything or to basically follow the precautions, but also is a question about the health risk. What is the health assessment or health risk to the person with any underlying conditions, exposure? And that's probably the biggest addition that I would make to that answer.
Okay, thank you very much. Okay, we're going to move on to the second question. We received a couple of questions related to the visitation restrictions currently in place that restrict families from visiting their family members or the person that they care about with disabilities who are living in the community but supported by a provider. So a group home scenario comes to mind. And then those individuals are also restricted from coming out of their home and visiting with families in the family home. So the question is, does DDA have a plan to remove these restrictions? If so, is there a timeline, or is it up to the provider? And so Janet, I'm going to ask you to address this question first, please.
Okay, so first of all, the DDA wants to support families, and we do understand that families are anxious to get together and connect with their family members. I do believe most of our providers are doing everything they can to utilize video conferencing and other strategies to allow those visits to occur. But as far as the opening, DDA has had some discussions with both internal and with providers concerning some guidance for recovery and reopening plans. We are also working with the DD Coalition and getting some of their recommendations and sharing information from national partners. However, each provider is going to be creating their own reopening plan based on their current business model, their capacity with milestones, processes, the specific people in the homes, etc. So in talking with a couple different people, we need to remember that if a provider has someone in the home who happens to be COVID positive and symptomatic, whether it's a staff or a person in services, the provider is protecting the family members as well as the people in the home. So keeping people out of the home is a protection for family members as well. They also are looking at people who are at bigger health risks. So this is all going to be based on the providers and their reopening plans.
Thank you, Janet. So Cindy, I'd like to throw it back at you again as a provider. What are some of your thoughts or response?
Yeah, it's interesting going second because I feel like I can just say, yeah, what she said.
You don't have to do that. No, you have to say something unique.
I will try. As a provider, and we happen to be a provider that doesn't have group homes. We support people that are living in their own homes, but also in certainly knowing residential services. So in all situations, any provider, as Janet indicated, needs to really set up guidelines and supports according to the people living in the home. So again, I go back to what I said earlier. It's that really doing a good risk assessment who in the home is at high, medium, or low risk. Remembering that as people go out social distancing and having people in, it's people that are asymptomatic that we don't know, are actively attached to COVID-19 in any way that create the biggest risk for folks. So the more I'm exposed outside, the more risk I have. It's up to the provider to really minimize those risks as much as possible. At the same time, these are the homes and families of people. So we need to be able to balance that. It's similar to the work situation where what precautions do you need to put in place? Does somebody need PPE, just mask, having sanitizer around? Can the person comfortably social distance if they go out walking with mom and dad in the park? Just having a structured plan in place with health and safety first, and then promoting social. Okay.
I'm sorry. Would you recommend that family members reach out to the provider that is supporting their family member to
Absolutely
ask these questions? Yeah.
And whether you're in a a residence where multiple people are living or the person's own home, it's important to work with, I think, the provider and the staff in that home, because you also have to look at the risk assessment with the staff. If everybody in the home's healthy, but the staff member has some high risk factors, you have to consider that because they'll be there once the visitors aren't. So yes, working with the provider to make any plans for socializing and visiting is critical.
This has been an issue so near and dear to our heart, not being restricted from seeing our daughter, but hearing all that you say, it just reminds me how critical it is. As much as we want to see her, and we're doing lots of FaceTiming, we really have to honor, and we honor the restrictions, but boy, some days you just feel like, forget the restrictions. But it's more than you and your family member. You've got staff and other people, so it's really important to pay attention. Well, thank you very much. Okay, so next question, still back to you, Cindy. Or actually, I'm going to begin with Janet, but it's related to day programs. And the question is, where does DDA think day programs are headed regarding programming in social distancing and wearing masks? So it's kind of a similar kind of question. Will programs, like Chimes, open?
Okay, again, as I said before, the DDA is having discussions with providers. We've been sharing information with providers to consider how to operate right now, how to move forward based on various national efforts and recommendations. Providers are looking at CDC guidelines. They're looking again at their own internal business and staffing model. There are no specific dates set up right now. And every provider, again, is going to be doing things a little bit differently, but they are developing plans. Some providers have become very creative and have figured out other ways to offer some of the services that they've been offering for day services. Some are still working on that. I do believe, and this is my personal opinion, not DDA's, nobody else's, but I do believe probably masks will be part of an early solution to returning. I think social distancing is something that the governor has still encouraged. So likely there will be precautions with social distancing, masks, hand sanitizer, sanitizing other areas, but it'll depend on each provider again.
Beautiful segue into Cindy again. What are your thoughts?
I did what Janet said. I think in addition to, we have, my experience right now is a lot of providers are looking at this as an opportunity to also address some alternatives as opposed to going back into larger congregate settings. So how can we take more of the services out in the community than we did before? How can we create maybe alternative options so that some people are in places that aren't as large a group as may have been before? Is there alternating schedules? Really, I think looking at Maryland as a priority for employment first state. How do we really start making those steps? Again, it's easy for me to say because I work at a provider that we don't provide congregate day supports. So we've worked through a lot of those challenges, and they are challenges, but this is a tremendous time to do so. Janet mentioned about up to the providers. You think so, we all believe that some of those same precautions will be in place that are in place right now. The other thing that I think I would add is it's not just about going back to a day program, it's about getting there and back home again. And so transportation becomes an issue. How many people are riding together? How are they getting there? Is it public transportation? Is it the vans? That's a critical factor that is easy to overlook and can be just as crucial to somebody's health and safety. So I would add that.
Thank you. Thank you so much. Okay. The next question is for you, Stacy. We have two questions around transition, and transition is a huge, huge topic. And there's so much involved in transition. But the first question is, my son is 14. What should I be doing in anticipation for his transition?
Hi, everybody. So, right, this is a huge question, and I feel like we could probably spend 3 days talking about it. I'll give a shorter version of the answer for that, a broader answer. So specifically related to DDA services and supports, let me just remind people that you can apply to DDA services at any time, at any age. So that may have already happened. But if not, 14 is a good age to do that, to apply to your DDA regional office for services. And once you're determined eligible, those waiver applications need to be completed the year that you become eligible for that transitioning youth funding. But there's so much more related to preparing for transition that really doesn't necessarily have anything to do with eligibility, services, and supports. And I want to make you aware of a really wonderful resource, and it's actually attached to today's presentation. And I do believe Donna is sending out attachments that go with this presentation to everybody that's on the webinar. And it is a transition guide that was developed by our partners at the Maryland Department of Disabilities, along with support from other agencies like DDA. And the guide is called the Maryland Transition Resource Guide. And it's really wonderful. It's actually set up for both youth that are transitioning as well as for family members to focus on that transition into adulthood. So I would really encourage family members to take a look at the resource. It's got so many different things for you to consider. But again, transition into adulthood is about so much more than just getting connected to services and supports. And so some of the no-nonsense kind of things to be thinking about, really helping your son or daughter to just explore interests, explore what skills your son or daughter might have that they want to expand upon, or maybe skills that they haven't yet learned that they would like to learn. And always be thinking about what might those skills or interests or abilities lead to in reference to employment in the future.
Yeah. Thank you.
Helping your child, sorry.
Oh, go ahead.
Yep, helping your child develop relationships is also a huge factor. So what are the other relationships, maybe beyond just other students? Really focusing on creating a vision of what your son or daughter's life, what they want it to look like in both the near future. So maybe thinking about finishing out school, but then what will things look like when they're no longer in school? Where would they like to be working? Where might they want to go to school? And so thinking back to Mary Ann's comment about charting the LifeCourse tools, so the integrated STAR is a wonderful tool to be using all the time. So Mary Ann showed.
I'm sorry, Stace, what I want to add here is that as part of the document, actually this will go out in an email to all of you, is the Charting the LifeCourse framework, a transition guide to complement what the resource that Stacy has already referenced. It's just a 4-pager, but it helps you to think through all of these questions in a short way, and I think you'll find it useful. So with that, Stace. Let me follow up with the next question because it's directly related to transition. So this question, again, we have another 14-year-old, and his or her parent tells us that he or she has autism, has on the autism spectrum, and they're wondering about what supports may be available to their son or daughter, particularly in the future, but more particular related to college. And I know, again, that's a huge question, but how might you answer that?
Yep, and I still had a few other things to mention in relation to preparing for transition, and I don't want to lose those, if that's okay, before I talk about
go ahead. Please go ahead.
And it'll streamline exactly into the next question, but I want to just bring home another set of resources. Again, we know that children or youth in school having paid work experience prior to transition is a really critical piece that can lead to success after transition. So at 14, students with disabilities that are in school are eligible to receive pre-employment transition services through the Division of Rehab Services, and through pre-ETS, there are opportunities for youth to experience things like job exploration, work-based learning, learning about self-advocacy, work readiness training. So I just wanted to put that one more thing out there. But
thank you.
So sorry about that. I just want to make sure I said that. And also
perfect.
Your question about thinking about college. So again, that fits right in. If that's part of the vision for what's going to happen when I leave school, excellent. So I want to make you aware of yet another tool or another resource, and that is Think College, the Think College website, thinkcollege.net. It's just really a wonderful kind of clearinghouse specifically related to higher education for people with disabilities. So if you go to that website, you will see a ton of planning guides that work through all kinds of questions, like, is college possible? You know, what is it? What might it look like? How can I afford college? Where can I find a college that's going to be able to support my son or daughter with a disability? What are some financial considerations that we need to be thinking about? And obviously, it's always important to make financial considerations as early as possible for obvious reasons. And how do we begin preparing for college? What, you know, maybe while your son or daughter is still in middle school, what can we be doing now? So there's a couple of other really neat resources, like Facebook groups that you can join with other parents of students with disabilities that are engaged in higher education. They have regular webinars about all of these different things. So I think all the things that I said related to the first question apply, but then this added resource related to college.
Awesome. Thank you so much, Stacy. Thank you. Okay, the next question. This is related to assistive technology, and Jessica, I'm going to ask this of you first. So the question says, can you tell me how I can obtain assistive technology? So this is a parent writing, to help me and my son remain connected during COVID-19 and beyond. He doesn't speak, but I need to see him. She lives a good distance away. Does technology assistance, as you know it, include purchasing of new iPads? And what about the access to the internet?
The iPad is accessible.
I think, Jessica, you're frozen there. I'll tell you what, Jessica, you're frozen, so I'm going to come back to you. I'm going to move on to the next question. All righty? The next question is...
So, Mary Ann, before you move to the next question, I do want to tell folks that this coming Friday, we are going to have the Maryland Assistive Technology group do a presentation on assistive technology. And so please join us for that webinar on this coming Friday. They may be able to answer some more specific questions about assistive technology.
Excellent. Thank you, Patricia. And we got Jessica back. All right, Jessica.
Do you have me?
Yep, we have you.
Okay. iPads are accessible, are considered accessible technology. So are Android devices, and Windows-based computers are also considered accessible technology because they have accessible features built into those devices for people with various disabilities. Vision, mobility, hearing, learning, they're all in there. The iPad, in my opinion, and this is my opinion only as somebody who is disabled, I'm blind, and I use an iPad. It is one of the most accessible devices I've ever owned and have at this time. The internet part of that question, I don't believe that it is considered that you can have assistance with that, but you'd have to check into that. The two programs the Department of Rehab Services, they can help you with purchase equipment depending on your needs. Also, there is the Maryland TAP program, which is a cost loan program, low interest, and you can apply, and there's some guidelines that you have to follow, but it is a very easy process. I've applied years ago. It took within a day that I was approved, and I was able to purchase some technology that I needed for my own self. I would check into both of those. Also, DDA has if those two programs can't help you, there is in our waiver, depending on the waiver, is accessibility technology assistance. But again, it just depends on your needs, and you have to go through the other programs first.
And in our resource section, we in fact do list some resources that make internet more accessible, more affordable. Google has a program, Spectrum
Yes.
has a program, and then Patricia, I don't know if, did you want to add anything else?
This is Rhonda.
Rhonda, go ahead.
I was going to add that as Jessica mentioned, the assistive technology service is in all three of our waiver programs, so that is based on people's assessed needs, so that can be considered. In the waiver programs, however, we do not cover internet services, but the technology itself would be something that could be considered based on need.
Okay, thank you very much.
And I'd like to add one more thing, if it's possible.
Sure.
I'm also in the process of creating a webinar on touching on the iPad, the Windows devices, and Android devices on the various accessibility features for various disabilities and how you can use those, each of those sections. So I'm in the process of doing that because this is a new time that we're living in, and a lot of people are using a lot of accessible technology to do FaceTime and to have individuals interact with their community in some way or some form and with other people. So we are working on that. So as soon as that is completed, we will be passing that information out so families and individuals can attend and staff, and so they can learn how we can work together and make accessible technology user-friendly for everybody.
Wonderful, thank you. So I've got one more question for you, Jessica.
Yes.
Are there resources available for people with developmental disabilities who may not understand all the issues related to COVID-19, like social distancing, testing, and wearing masks, that you're aware of?
I have one that I know of, and that is it is selfadvocacyinfo.org, and it has some pretty good information on it, on some information. But from my own point of view, if you have an individual, I would suggest showing them how far is social distancing. You know, get them to stand from one point to the other and say, this is how far you have to stand from somebody, so they can not only understand it from what you're saying, but also get a sense of seeing it and experience it, because not everybody knows how far that is, and they might not understand it. So if you give them examples and show them, okay, walk, 5 steps away, this is, distance, that that could be helpful. Also, some people have created silly little songs to help individuals when they're washing their hands, to help them with making it fun and interesting, because, you know, if it's more fun, we're all going to be doing it. So,
Yeah.
So some families have made up little, you know, silly songs with the alphabet or with the birthday song, you know, creating their own little words. So those are types of things that you can do. Wearing a mask, again, not everybody's going to be able to wear a mask. So you have to consider, okay, my disabled person, my person with a disability, they can tolerate a mask for 10 minutes. So each day you work with that person 10 minutes a day, you keep extending it so they can get used to it. Find out what type of mask they can tolerate. Some people can tolerate the cloth mask versus, you know, the standard hospital type mask. So those are kinds of things you need to look into. Also, if you're creating a mask, you could have the person help you pick out the material, help you make it, so it makes it more a part of them and they're all a part of the whole process. So those are just a couple things that I would suggest from my point of view as a person with a disability.
Those are wonderful, wonderful, brilliant suggestions. Thank you, Jessica.
You're welcome.
Yeah, thank you very much. And actually, Jessica, you had sent me a link, which we again capture on our resource slide. There's two resource slides in this presentation. SARTAC. Yeah, they have some wonderful videos there.
Yeah, that's
for people
what I was
with. Oh, okay, okay. Well, very good. Well, thank you so much. So my next question is for you, Janet. This family, they're working on their son's proposed person-centered plan for years 2020, although we're almost out of 2020, and 21. Their question is, do they focus on his needs now, as particularly related to COVID, or what they expected to focus on prior to the pandemic?
Okay, so this is a little bit of a complex answer, I think. First of all, the DDA Appendix K did provide the option for families and their coordinators of community service to conduct person-centered planning meetings virtually or remotely in lieu of face-to-face meetings. So I just want to make sure that people are aware of that, so you don't have to worry about the safety of that. So each person's person-centered plan should provide a picture of the person's self-identified good life, and we've heard about that from Marianne and others on previous webcasts. And it should include various focus area exploration topics such as employment, community living, anything else that the person really is focused on. Based on the information that's going to come out of that, the coordinator is going to work with the person to determine which are the most appropriate services. Sometimes the Charting the Life course integrated STAR is a really useful tool for families to use with their loved one and their team to look at an array of integrated supports and not just the DDA or the entitlement services. It could include public or privately funded services and those based on eligibility that are available to everyone, relation-based services, etc. So the integrated STAR, as Marianne has talked about in previous sessions and talked a little bit about today, is one tool to use. Specifically to the pandemic, I would say that you need to be looking at the person's needs now, but also planning for the future. So if you know that there's some other things that your son or daughter is going to want to focus on during the year, you should talk to the team about that, and they can try to figure out ways to incorporate that into the plan. However, if after the pandemic, for some reason, the person has experienced a change in their habilitative or their health and safety needs based on COVID-19, the individual and the team can submit a revised person-centered plan that would identify their newly assessed needs and request either additional or comparable different services to meet those needs.
Wow. All right. Thank you. Thank you. All righty. Our next question is a whopper of a question, and Patricia, I believe you have agreed to answer it. So I'm going to read it to give everybody a sense of the question, but it's such an important question. So the first piece is, what is the timeline for applying for DDA services? They also ask about documentation you need, how long does it take, and when should you start the process? Do you want to just begin with that one, Patricia, and then I'll go into the others?
Sure. So
Marianne,
thank you so much. I had asked that Rhonda respond, but I will say this really important, that I just think is really important for folks to know that they can apply to DDA at any time, and the earlier and the sooner the better. And even if you apply for the DDA and you were denied, does it mean that if the situation has changed in the person's life or in your life, that you can go back to the original office and submit additional information for reconsideration? So I'm going to turn this one over to Rhonda. And Rhonda, if you could add more to that, appreciate it.
sure, absolutely. And as Stacy said, you know,
We've lost you, Rhonda.
children are very
Rhonda, we can't hear you.
okay. Can you hear me now, Marianne?
I can now. Yes, thank you.
Okay, great. Sorry about that. I was just Stacy. So we have very young children that apply for our services, up to, you know, adults and even seniors that are applying for DDA services. So you can apply at any time, as Patricia had mentioned. And in terms of documentation, you know, we do have our application on our website. You can also contact our regional office, and we're happy to help facilitate the application process. We can have one of our coordinators of community services contact you and the family to kind of walk you through that application and provide assistance in terms of our DDA application. And some of the documentation that would be helpful would include things like previous assessments that kind of demonstrate some of the needs and abilities of the person, so that we can really make a determination as to whether the person meets the required standards or criteria to be eligible.
Thank you. Well, so you mentioned the CCS, or the Coordinator of Community Services. How and when does a person receive or get a Coordinator of Community Services?
A great question. And so initially, when you contact the regional office, we need a CCS, a Coordinator of Community Services, to come out and provide assistance with that application process. Once we make a determination as to whether that person, that individual, is eligible for DDA services, we will then make a determination related to their priority category based on DDA regulations. We classify, categorize people based on their circumstances. Then we have crisis prevention and current requests. When you are determined eligible for DDA services and placed on the DDA waiting list, then if you meet our developed eligibility category, we then offer the opportunity to access our coordination of community services, so that a case management person of additional.
Rhonda, you're breaking up, Rhonda.
That's okay. I'm going to step in only because our sound is not really well. So I am going to give some resources for some folks. So we have in our DDA website, and if you go under the training section, some information about DDA's eligibility. We did some webinars this summer that talked about how do you apply for services and what are the different party categories that Rhonda was talking about. And pretty much that everybody that we support in our services, we provide home and community-based services and all through the waiver. So people have to have not only the DDA eligibility, but the waiver eligibility. And with that is based on when people apply, first come, based on the data they apply for the services, based if they meet the criteria, and the base of those categories that Rhonda was talking about. And at any given time, those categories can change based on the person's situations.
Thank you, Patricia. So a follow-up question is, can you tell me the difference between the various waivers, community pathways versus family supports waiver or the community waiver? And how do you decide which is best?
That's a great question. This is Rhonda's cup of tea, but I will definitely be happy to respond to this one while she gets her sound in order. So our three waivers are pretty much a step into the next waiver. We really want, when we're talking about what per person's waiver should be, it is based on an assessed need, based on what that waiver covers for that person. And we have the family supports waiver. They are from 0 to 21. And those are for services for people who are either for supports for weekends, evenings, and summer. Please know that in that waiver, we don't offer the meaningful day services, and we don't offer the residential. And the next one is our community supports waiver. And our community supports waiver offers all the array of services that we have. And in addition to that, all the meaningful day services. That means the employment services, the rehabilitation, all those, right? And then our comprehensive waiver, which is our community based waiver or home and community based waiver, it includes everything's in the other two waivers in addition to residential. Now, and there's no cap to that. No funding cap. For the family supports and the community supports, there is a funding cap. And so, Rhonda, how's your sound going?
I'm hoping it's better. Marianne, can you hear me now?
We can hear you.
Okay, great. I think the main thing I would say is just echoing that, as Patricia mentioned, we have a lot of webinars on our website that talk about the different waivers and details. But before thinking about a waiver program, I want to go back to the integrated STAR and really talking about the life trajectory. The first thing that all people and teams should consider is what's the trajectory towards a good life? What are you trying to achieve? What's the supports that are needed that may not be met? But first you need to know the goal. What are you trying to reach? And using the integrated STAR and other strategies to identify that is extremely important. Once you identify those goals and that trajectory and look to see if you have any unmet needs, then that's where the DDA services would come into play, and we can help to guide and make sure that the right waiver program is identified to support that need. So really, as Patricia's mentioning, the family supports waiver provides support services like assistive technology and respite, and it's really designed for children when they're not in school, during the summer months and such. Our community supports waiver serves all ages, and it includes the same support services like that assistive technology and respite, but also includes those meaningful day supports because it supports adults who may not be in school at this time. And then the community pathways waiver includes the same meaningful day and support services, but we did add those residential services. So the bottom line again, think about the trajectory towards a good life, the goals, and then identify what maybe additional supports are needed through that integrated STAR strategy, and then we can help to support to identify the right program to meet those needs.
Thank you, Rhonda and Patricia. So in other words, is it safe to say, if you were working with a family, to say, look, don't even worry about the waiver. Which waiver? Just, we want to focus on the vision, what your needs are, not to worry about the waiver. Okay,
absolutely.
Terrific.
Absolutely.
Okay, thank you. So I've got one more question. I know we're getting close to the end of our time, but I've got another question for you, Rhonda or Patricia. This family member has a child who is currently being served through the autism waiver, and he will be exiting in the next few years. The question is, when should they apply to DDA to ensure that when he exits the autism waiver, he'll be eligible to receive services through DDA, hence a continuation of services?
That's a great question. And again, as we mentioned, you can apply to DDA at any time. So there's no need to wait. You can apply. One additional thing about a Medicaid waiver program, because the autism waiver is a Medicaid program, in addition to the DDA waiver programs or Medicaid programs, a person can only be enrolled in one Medicaid program at a time. And then you could apply and be on a waiting list for other programs for the future. The ability that when you're offered the opportunity to apply to any additional waiver programs, then you have that opportunity to make a choice for which meets your needs best. So in terms of autism waiver current participants that may be aging out or transitioning out in the next few years, definitely reach out, make sure that you have contacted the DDA, that you have submitted an application. You can find out your status and make sure that's completed. But I would do that as soon as you can, particularly if you're aging out in the next couple of years. When the time comes and we have our coordinators of community services, in addition to the autism waiver case managers, which are called service coordinators, they're going to come together and work together with you as a team to support the waiver application process for the DDA. So it's important to note that even though a person may be enrolled in the autism waiver, not automatically enrolled or transitioned into one of the DDA waiver programs. These are all different and distinct programs, and so we would have to go through the waiver application process, and eligibility would have to be established based on the eligibility for the DDA waiver programs, which slightly differs from the autism waiver program.
All right. Thank you, Rhonda. Thank you so much. We have about 5 more minutes to take questions. Erin, has anyone submitted any additional questions?
Yeah, hi everyone. I have been monitoring the chat. There are lots of questions that came in, and actually somebody just sent one saying, you're not going to get to all of these questions. How will, is there a way that we're going to be able to get responses? So let's start with that.
So I think that some of the questions that we don't get to, we've either have answered them through either the summer webinars that we've done. I think it's really important for families and people in services to understand what's available. What is the criteria first to get DD services? Understand what those 3 waivers offer, and then know where to go if you need assistance. Where are the regional offices? We have 4 regional offices across the state. There's a regional director in each office. You can call and ask any specific questions, and we'd be glad to provide those supports and answers. So while we may not be able to do it here, we are available. You can email us. You can see who is doing what. Like if you have any specific questions about the waiver, make sure you let Rhonda know. Anything about children's services, Janet, so we are available. If we cannot answer them today, please know that you can always email us and we'll be happy to give you back a response. Go ahead, Erin.
Thanks, Patricia. So here's a question from a family member who heard recently that there was a change in the number of retainer days that residential providers can receive. And she wants to know, does that mean family members are limited to a total of only 18 days that their son or daughter could visit at home with them?
So I can help to address that question if you'd like.
Yes.
So we have a lot of information on our website that you can look at to include frequently asked questions associated with retainer payments. The important thing for our families to understand is retainer payments are associated with the ability for a provider to get reimbursed for a certain number of days when the person is not in the home or not receiving services. And they can be used when someone may be sick and is in the hospital for some time, or maybe when they go on vacation. And under the federal rules, there's limitations to that. But that does not limit in any way a family member or an individual's right to go on vacations, to go spend time with their families. So there is no limitation related to that. And we encourage that family unity and the opportunities and the rights of the person to be able to go on vacations and do things as they so choose.
Thank you, Rhonda. Karen, do you have any more? You're muted.
I'm sorry, I was saying we have 5 minutes left. I know you have some wrap up.
Okay, yeah, we'll do that. So first of all, I just want to thank all of the presenters, Cindy, Jessica, Rhonda, Patricia, Janet, and Stacy. I think you did an awesome job, and I just can't thank you enough. With that, I'm going to advance my screen. I have to get out. I gotta let you guys go first. All righty. What I want to do, so we started out thinking about the integrated supports and how the integrated support starts as it relates to a person or a family, and as a tool to map your resources. And we identified DDA as being one of those resources in the eligibility specific supports. So I want to flip it a little bit now. Based on the questions we were asked and were responded to, our responders identified a slew of different organizations, agencies, and programs that are available to folks to support them. And so with that, I created an integrated star called DDA, DDA's resources. Now, DDA has many more resources than just this, but these pertain to the questions asked today. And I just want you to consider DDA, one of their greatest resources happens to be families, people with disabilities, advocates, providers, school systems. So, and the strengths and assets of all of these. It makes life for people possible within the community. DDA depends on its relationships with all of these folks, state and national partners, in order to support people. Technology, clearly, MTAP, VLink, Disability Scoop, Spectrum, more affordable internet programs. These all assist DDA in one way or another to support you. Community resources available to everyone. Again, Spectrum, more affordable internet, businesses, local school systems, the CDC, local health departments. All of these things are available, and they're part of the entire package. And of course, DDA is not the only eligibility specific support available. You've got Medicaid, Social Security, DOORS, the Developmental Disability Council, the Department of Disabilities, Maryland State Department of Education, our providers. All of these are part of this entire network, really are part of our entire community, our state that supports people with disabilities. I want to show you, we've got two slides here related to resources. This first slide is more specific to resources we identified in our conversation today. And then I've also included, I just pulled this from our transitioning webinar because there were so many there was an in-depth conversation around transition, and these were some of the basic resources available to folks and are here for you to access. And with that, we've already done the questions. I just want to thank you for joining us. I want to thank Deputy Secretary Simons and DDA for supporting the Maryland Community Practice in hosting this webinar. And again, Patricia, Rhonda, Janet, Stacy, Cindy, and Jessica, all for your time and energy and expertise today. And I hope you all will join us on June 24th for our next webinar on employment. Go ahead, who was that?
That was me, Marianne. Sorry about that. I just, I know I talked to you guys about this Friday's webinar that we were going to have the assistive technology and talk about that, but we're also going to have Marcella Frankowski, who's the Assistant State Superintendent of the Division of Special Education and Early Intervention Services, who's going to be talking about transitioning youth. So if you want to join us and talk to listen to what she has to say, how we're addressing transition youth in the state of Maryland with developmental disabilities, please join us this coming Friday at 1. Thank you, Marianne.
Oh, thank you. That's perfect. Okay, everyone, have a great day and take care. Bye-bye.
Bye.